Hey, it's Dr. C back again. Second show on first aid. We ended up the last time very quickly on cuts. And just to finish that off, we had talked about straight cuts where you could put a steri strip. That's going to be in your first aid kit. But if you have a ragged cut, you're going to have to take them to the doctor. What does the doctor have to do? Well, if you see a ragged cut and the guy just wants to throw a couple of sutures in, no way. What the purpose of seeing a doctor is, number one, make those edges nice and clean. So usually after the anesthetic's in, they're going to take the edges of that off so it's nice and smooth. Then they put the sutures in. So you got to watch. Make sure how the doctor does that, So just to give you a heads up. Now, I did miss a couple of things on the way. And I guess maybe quickly I'm just going to mention that. Because if you go to a first aid course, for example, that the Red Cross gives, they're going to talk about CPR. I'm not going to talk about CPR here, except I'm going to tell you, nowadays, you just need to do the compressions. Just the compressions. We do about, and you use the butt of your hand, one on top of the other, and you compress. How far do you compress? 2 to 2.5 inches in. Has to be at least 2 inches in, right over the end of the sternum. Okay? Now, how many do you do? 110 to 120 a minute. You do a lot of compressions without giving a breath. Now, before, we used to do both. You got to give them a breath. Then you're going to do the CPR, then you're going to give them another breath. So that's a little change in the CPR manual. The other thing, too, that you may see out there is an AED, which is an automated defibrillation unit. And so you see these things. They're a pad that you can put on to the person who's the victim, basically. And the pad is put on. There are electrodes that are implanted in that pad exactly where they should go. And it's connected up to a device that can defibrillate them. And so, but that's in a, it should be in every public building. It's not. And I can tell you that because I've gone to a lot of the nursing homes around here or senior agencies, and they don't all have an AED. And I'm not sure if there's a regulation that they have to have it, but, they don't in all of them. So, what do you do if you're choking? Normally, what we're choking on is usually some food. But kids, God darn, they put everything either in their mouth, their ears, their nose, whatever. They can choke on something as well. I know, I've had it happen. So, not to me, thank God, but I've seen it enough. Now you have two ways of taking care of it. One is doing a Heimlich Maneuver where you take your hand around the body, right over the top, right at the end of the sternum here, and you give a sudden, quick push in. That blows air out quickly and usually will blow a particle out. Now, nowadays, there's people who are so goddamn fat you can't get your hands around them. Or number two, they're fighting because they're choking and you just can't calm them down. There's another little device. This is called a life vac. And what it is, basically, instead of squeezing the patient with a Heimlich maneuver, this fits over the patient's mouth. This is a regular, go right over the mouth, like that. And so you're on top, you push down, and what it does, it sucks. So it sucks out that piece of whatever that foreign body is in the mouth. I still prefer the Heimlich maneuver, but this is a good secondary thing to have around, called a life vac. Life vac. So those are the things with the sudden things with the breathing. What about a foreign object in the eye? Well, let's talk about the eye for a moment. There are things to have in your kit for the eye. Number one, and I find it a very valuable thing to have, is a very simple little thing. It's just a rubber squeezy. That's it. Just a little rubber thing. And what you can do is to use saline, and usually I have a bottle of saline. You can make your own saline. You just use a half a teaspoon of salt and 8 ounces of water, and you've got 0.9% saline. I love to use saline solution. It's cheap, it's effective, and you can make it yourself. That's the beauty of it. So I got the saline, and you want to have it skin temperature. You don't want it too hot or too cold. Skin temperature. So you fill that sucker up, get that eye. How do you get the eye? What you do is you put a finger below and a finger above holding the lid up and squirt it in. You're going to get a lot of the foreign body material out that way. Squirt it in. If you have to do it 3-4 times, do it. Do it. Now, the types of things that you can buy are simply saline, for example, or wound saline. And just put that, but you can't put it into one of these squeeze-its. Can't do that. That's why I like to make my own bottle. Okay, so that is for the eye. What type of eye drops are there, and what can you use? Well, make sure when you get this stuff for your first aid kit, make sure the dates are okay. Now, they put dates on everything. I usually ignore the goddamn dates. They're for the companies that sell this stuff. But there's a couple of different things that you have to pay attention to the dates. And one is eye drops. Eye drops. They have a preservative they put into that eye drop. That preservative will wear off very quickly. Get those drops changed. Get them changed. Look at the dates, especially on those eye drops. I don't care if you use a decongestant like, for example, Visine. It's just a decongestant. It just shrinks down the blood vessels, gives it a little less irritation. Some of the eye drops contain a steroid, but nevertheless, you want to get the inflammation down. After you've done that, and hopefully you've done it successfully, examine the whole cornea of the eye, the white of the eye, examine it all. Make sure you got whatever that foreign body, make sure it's out of there. If it's not out of there, what I usually do is I'll take a little Q-tip. Q-tip should be in your little first aid kit as well. And I flip up. I put the Q-tip onto the eyelid itself, on the top eyelid, and I flip up the eyelid. So now I'm looking at the bottom, the inside of the eyelid. A lot of times you'll get a little foreign body embedded in that tissue. So then I'll take a little moistened Q-tip and get it out of there. After you've done that, and successfully hopefully, now what you need to do is to put an antibiotic drop in and then patch the eye, because it's still going to be irritated, and they think they still feel a foreign body, and it really may not be. But then I want to put the eye to rest. So I will use a little iPad, and I have iPads in my somewhere here. I don't know where, but I have iPads Well, take my word for it. I got iPads. So at any rate, I'll use the iPad and then a piece of tape over that. Okay, so that is the first aid for the eye. How about the ear? Well, there's a couple of things that can get embedded in the ear. The most common thing is earwax. You'll get some, especially seniors who have hearing aids. That stimulates a little bit of that wax. Now, normally, the wax is normal stuff. This is something that the body produces to help you. It not only keeps the lining of the ear canal soft, but it also kills bacteria that are in there. So it's there for a reason. But it can get stimulated excessive amounts of wax. And what do? We use a Q-tip. You clean the outside part of the canal, but you're pushing the other stuff in further, and you can get what they call an impaction. A big glob of earwax and some of the material from that Q-tip. So you got to get it out. So if you go to the doctor, what they're going to do is they're going to use an instrument that will blow it out. What they do is it's a big thing usually, and they'll squeeze. It's sort of like this. And in fact, I've used this for some of the ears as well, and because it gives you a gentle flow. You don't want to make it too hard because you can injure the eardrum, and that's not a good thing. Not a good thing. So we use generally Debrox. Debrox uses just a combination of stuff to soften the wax. You don't have to go and buy Debrox. You can make your own, half hydrogen peroxide, half water. That's all you do. And then you can or you can use peroxide full if you want. Put about 5 to 10 drops with the patient down so it stays in. 5 to 10 drops. That helps to soften that wax. Now, once the wax is softened, then you can use one of these with skin temperature water. If you use water that's too hot or too cold, you're going to have the patient all over the place because you're going to influence the balance center. So you got to keep the temperature, skin temperature water only. Okay? So that's what you do for wax. Now, what do you do if you stupidly put something in your ear? Well, there are some things you can buy over the counter that, just like that LifeVac thing, will use suction to pull it out. And so you can buy one of those. You just put it in and a little push on it and then pull it out just like that. Now, what if you get an insect in the ear? Anybody, any age can get an insect in the ear. Well, what do? We put in things like either olive oil or one of the oils. 5 to 10 drops of the oil. What that does is that the insect does not want to drown in oil. The insect frequently will come out if it's alive. If it's not, then you can go ahead afterwards and just extract it with the oil. Okay, so that's what we do for the ears. Let's go on. What else? Burns. What do we do for burns? Well, we're going to talk about burns and cold. We'll talk about both, frostbite. So, burns, you have 1st degree, 2nd degree, 3rd degree, depending on how badly the skin is burned. 1st degree burn would be just like a suntan. 2nd degree burn, you can get a little bleb formation on it, and it begins to get some pain, significant pain. 3rd degree burn, not a painful burn because you've killed the skin and the little nerve endings that are in the skin. So that is the different degrees. Same with frostbite. You can get frost nip which is just the early part of the frostbite. You can get second-degree frostbite, where you begin to get these little blebs and all. And you can get third degree, where you get almost like leather, and you get dark blue colored skin with big blebs on it. So it can be any one of those three. First degree burn, if you need to put something on, you can put on the 1% hydrocortisone cream. You can do it as frequently as you need to. Or you can use aloe vera. Aloe vera is a very good substance to put on. Some people will use witch hazel. Witch hazel is it's an astringent, basically. I have witch hazel in my kit as well. And so I'll use witch hazel to do some of the relief. Witch hazel will give you a very relieving type of coolness on it as well. And so those are things you can do for first degree. And you can do it for the frostbite. You need to just warm it. It needs to get warmed slowly. Okay. So second degree, what do we do for that? Well, if you start to get bleb formation, usually that happens because of the use of a stove, hot water. That is the most frequent cause. Or it could be a fireplace, but something that causes a second degree burn. Don't pop the bleb. Leave the bleb there if it's a bleb. And just put something on topically. And usually what we use there, if you take them to a hospital and all, they'll use a thing called Silvadine Cream. That gives you, it's called silver sulfadiazine. And so they use a combination of the sulfa and silver, which both inhibit infection as well. And so that's what they do at the hospital. If you have a second degree at home, you might want to just use that Neosporin or bacitracin cream, and then cover it and then wrap it, but not as tightly as you would wrap, say, a cut. You would just gently wrap it. Okay, so that's for a second degree. Third degree, they're going to the hospital. There's no question. You're going to lose tissue, so best to just take them there. Okay, so that is hot and cold. So what else do we have? Well, let's talk about dental. A lot of things with dental that we have to discuss, and we all have, unfortunately, cavities. And we have fillings. Those damn fillings can fall out. What do you do? Especially if it falls out and it's painful. So we have to deal not only with the hole in your tooth now, but the pain as well. So what do we do? Well, there's a thing called Dent Dentep. And what it is basically is that it uses a zinc phosphate, which is the basic filler, the zinc phosphate, and it uses a glass ionomer, which is the binding agent. So you have the filler and the binding agent. You take that, and there's a little, you can see there's a little instrument on here as well, and you just use that, tap it into the little hole if it's a missing filling. Let's say that a cap fell off. What you can do then, you want to put the cap back on, but you want to use something that's going to make it adhere. And so you dry and a little alcohol to sterilize the cap, put a little bit of this in, and flip it back on. Why do I tell you this? Because it's damn tough to reach your dentist. I don't care. Everything always seems to happen away from their office hours. And you cannot get urgent dental care very easily. And so that's why I like to keep that Dentep around. Good stuff to have. Good stuff to have around. Okay. What else now besides the dental? Well, let's talk about poisoning. Well, what type of poisons are there out there? Well, you can get exposed to poisons in many ways. You can inhale it. You can swallow it, like, say, arsenic or something, but whatever. So there's various ways of getting exposed to different types of poisons. You can get poison on your skin. For example, if you own a pool and all, they tell you, well, don't splash that onto your skin, wear gloves, etc. Well, you know, most of us will go out there, throw it in, oh Christ, splash me a little bit, wash it off. Yeah, well, that's okay for most of the cases, but not always, not always. So what do you do if you get it onto your skin? Wash. Immediately wash it right off. Try to get skin temperature water, and once you've soaked it washed it off for a good minute, 2 minutes and all, then you might want to use a soap and water to wash it all off. Usually that it's okay for an arm or a leg or that type. What if you get it splashed in your eye? Then you may have to take a little bit longer, especially if it's either an acid or alkali. You really got to get them quickly in and hold that open and give them a really good bathing, that eye a bathing, to get that out of there. What if you've inhaled it? Well, if you've inhaled it, you're going to have swelling immediately of the membrane in the nasal passage going down to the lung. So what are you going to do? Well, you can use cool, but that isn't going to be very quick, and it's not very pleasant. So you immediately got to use something to get that swelling down. If it's a big exposure, you got to get them in, call EMT 911. They may even have to put a tube in to get beyond that swollen area. So that's the poisonings anyway. So what about simple things like, say, a splinter? That happens frequently. You get a little splinter either in your finger, your toe, whatever. Well, usually what I'll do with a splinter, try to calm the person down because they're all upset because they got this damn splinter, and they'll show you a little dark hole in the center of a little puncture and all. Well, what I'll usually do is I will use a lidocaine patch or lidocaine ointment, one or the other, and I'll put it on. Okay, that's good. That takes a little bit of the local pain away. Now that we've got that a little bit on the number side, now I'll give it a little squeeze, and that shows me the little dark center because I've squeezed it, and that took all of the pink away from the area. Now I can clearly see that little splinter. Now I take my tweezers, and as I'm squeezing, I'm trying to get that out. A lot of times that'll be successful. Not always, but a lot of times it will. What if you're unsuccessful? Well, if you're unsuccessful, you're going to soak it. Why? Soaking will soften the whole area up. It'll soften the skin, soften the foreign body that's in there, and then when you come back later, give it that squeeze and all, it'll be a little easier to get that thing out. Okay, so that is a foreign body, a splinter, basically. And what do you do after? A little bit of antibiotic ointment and a Band-Aid. Make sure you have all of the different sizes of Band-Aids in your first aid kit. Okay, let's go on. Let's say that we get a sprain. The most common sprains, believe it or not, thumb and ankles. Why ankles? Because we're walking on irregular ground sometimes, and we just happen to go into a hole wrong or whatever, and you get a sprain. Well, what do you do for a damn sprain? Well, let's talk about an ankle first, okay? There's two ways of treating it. You've got to give it support, and you want to minimize the amount of bleeding because a sprain is an actual tear. It's an actual tear of tissue, so it's going to bleed a little, and it's going to swell. So you want to minimize the swelling, and you want to minimize the pain. How do I do that? Well, first of all, I can use an ace bandage, or I can use what I call a soft cast. Now, what this has, it looks like an ace bandage, but it is nice and soft. And I'm not going to open it because I don't want the stuff to dry, but in there's a thing called calamine lotion, zinc oxide, and glycerin, all embedded into this type of dressing. It's embedded in there. And so I use that as a wrap. The sooner you can get that wrap on and get some ice on it after you've put the boot on, this is called an Una boot or a soft cast, whatever you want to call it. Once you get that on, you put your ice over it and elevate the leg. Those are the things that you do acutely for an ankle sprain. Now, you can get a severe ankle sprain, especially if it's on the inside part of the ankle. A lot of the sprains are on the outside part. That is a lot easier to treat. The ones on the inside part, you got to worry about them after you've treated, because that ligament takes a lot to tear. And so if you sprain the inside part, it may lead to something later that needs to be fixed surgically. So what you do is you notify the person who's got that. You tell them, listen, if this gives you trouble after, you got to have an orthopedic consultation. So, okay. So basically that's for a sprained ankle. What about a sprained thumb? That happens very frequently. You've heard of people who tear the little muscle. There's a little muscle that holds that thumb in. And if you tear that muscle, then the thumb goes off. There's nothing actually holding that thumb in anymore. So it's off to an angle. That has to be repaired. That muscle has to be reattached. But if you just get a sprain, it just swells up. You can still have full motion and all. It's not off on an angle. It's just swollen. So what you want to do then, you put it at rest. And you can use one of the small ace bandages to put it at rest. And you rest it, put some ice on it, and hopefully in about a week's time, that will heal up and won't give them a lot of difficulty later. Okay. So with all these different things, you got to make sure you have the right phone numbers, the 911. Make sure you have the Poison Control Center number. Make sure you have the number of the patient's doctor as well. All that stuff should be in your kit. So these are all the things that I keep in my kit, and you should keep in yours as well. So this is Dr. C. I hope you've learned a little bit anyway on first aid, home first aid. Have a good day.